Hallux valgus is the most common foot deformity. The Hallux valgus is a deformity in the big toe at the metatarsophalangeal joint. There are two types of Hallux valgus, which is adult Hallux valgus and adolescent and juvenile Hallux valgus.
Incidence and prevalence. Research has found that about 18 to 19% of Malaysian adults suffer from some foot problems, and one of the reasons is due to uncorrected shoe size. Out of 1,210 participants were found that 135 women had problems in foot deformities such as Hallux valgus, concellulus and ingrowth toenail. Out of these, 38% of them experienced Hallux valgus.
Etiology of the condition. Etiology of the condition. 1. Gender. Sometimes more frequent in women. 2. Wearing tight shoe or heel shoe between 20 and 39 years of age can be crucial in the development of Hallux valgus in the later years. 3. Congenital deformity or predisposition for chronic Achilles tightness. 5. Severe flat foot. 6. Hypermobility of the first metatarsocuneiform joint. 7. Systematic disease.
The clinical features of this condition are position of the big toe dividing outward more than 10%. Commonly, the big toe is rotated by its axis, the first metatarsal bone protruding at the inside edge of the foot, callus protrusion at the inside metatarsophalangeal joint, in some cases inflamed, red swelling of the skin and bursa, flattening of the transverse arch of the foot and spread forefoot, decreased flexibility or fixation of deformity, deformity in adjacent toes is observed, Hallux valgus toe rotated around the longitudinal axis, callus pattern typical to Hallux valgus.
Pathophysiology. Valgus deviation of phalanx promotes valgus position of metatarsal. Metatarsal head displays medially, leaving the sesamoid complex laterally. Sesamoids remain within the respective head of flexor hallucis valgus tendon.
Investigation or diagnosis. First, physical exam. Hallux rests in valgus and pronated due to deforming forces. Examination should be performed with the patient both seated and standing. Second, radiographs used to determine the Hallux valgus angle.
Management. There are two types of treatment, which is non-operative, shoe modification, pad special, and operative, surgical correction.
Conservative. First, education. Second, exercise. And third, footwear changes. Choose a wide, soft and comfort shoes.
Surgical. First, softly tissue procedure. Use modified McBride. Second, metatarsal osteotomies. Use distal metatarsal osteotomy. Third, proximal phalanx osteotomies. Use Akine osteotomy. Fourth, fusion procedure. Use Lapidus procedure. Fifth, resection arthroplasty. Use proximal phalanx killer resection arthroplasty. There are over 150 different surgical procedures described for correction of the disc for foot problem. It is best to meet with a qualified physician to discuss options for your foot.
Prognosis. Without the right care, like changing your footwear or using orthotics, Hallux valgus can get worse over time. If you have severe pain when you walk or you stand, you may become inactive, which is not good for your health or quality of life. Most people get symptom relief with over-the-counter aids or through treatments at a medical office. If needed, surgery can help.
Impairment and functional limitation. Early states of the Hallux Valgus are characterized by intermittent appearance of symptoms and no restriction of normal activities. Range of motion is reduced at the first metatarsophalangeal joint but may be in only one direction. In the third stage of the condition, symptoms become more constant with loss of dorsiflexion and palatal flexion, progressing to the joint ankylosing. Primary concern of patients with the condition relate to impairment of walking, joint pain, and difficulty with footwear fitting.
Thank you.